A very good afternoon to everyone present here. I am Abhinav Fofalia, first year Masters in Hospital Administration student at Prasanna School of Public Health, MAHE, Manipal, India. It's my honor to welcome all the participants from 30 different countries to benefit from the 8th webinar organized by the Manipal Health Literacy Unit, known as MHLU, in collaboration with the Asian Health Literacy Association, known as AHLA. MHLU aims to excel in health literacy resources, policies, and practices. The AHLA seeks to understand health levels across Asia from research, educational, and policymakers' perspective. Collectively, MHLU and AHLA are initiating a webinar series on health literacy for healthcare providers, researchers, policymakers, industry, academia, and the public. Before I invite the first speaker of today's webinar, I have some important requests to the participants. A small request to the distinguished participants to kindly mute your cell phones and the mic. You may post any questions during the session through the chat box. We will be addressing a few selected questions considering the time limitations. In the today's webinar, we will be hearing insights from experts on how ranking can impact health literacy and education in the higher education sectors. Please note, the speaker will be sharing their insights for 15 minutes. It's my pleasure to introduce our first esteemed speaker of today's webinar, Professor Dr. Peter Chang, a distinguished figure in the field of health literacy. Dr. Chang's impressive credential and extensive experience have made him a leading advocate for improving healthcare communication and enhancing the quality of health services. Here are some key highlights about Dr. Peter Chang. He has served as an honorary and past president of the Asian Health Literacy Association, demonstrating his dedication to advancing health literacy in the Asian context. Dr. Chang's impact extends globally, having previously held the role of vice president and director of council of presidents at the International Health Literacy Association. His work transcends borders, emphasizing the importance of health literacy on a worldwide scale. As the International Director of Shaochuan Health System, Dr. Chang is deeply immersed in healthcare operations, making him well versed in the practical aspects of health literacy implementation. In addition to his professional roles, he serves as an adjunct professor at Tufts University School of Medicine, where he imparts his knowledge and expertise to the next generation of healthcare professions. Dr. Chang's work is pivotal in the promoting effective communication between healthcare professionals and patients, as well as their families, communities, schools, and society at large. He recognized health literacy as a fundamental component of patient-centric healthcare where patients actively engage in their care, leading to shared decision making and better health outcomes. Dr. Peter Chang's contributions are integral to the evolution of healthcare towards a more patient centric and effective future. We are privileged to have him with us today to share his insights on this critical subject. Over to you, sir.
Yeah, thank you so much for Abna for opening up and very good remarks about. And I'm very honored to give this the first presentation. I think we have the presentation already recorded, and I will stay with you. That I hopefully there was some more discussion after the short presentation. Thank you. Health literacy can help as a rescuer because it helps patients understand, acquire, and use their health information effectively. And health literacy helps healthcare professionals provide friendly information and instruction to the patient, family, and communities. Health literacy can also help patients and us, healthcare professionals, conduct health plans, solve difficult health decisions and treatment. And health literacy can provide better options to the patient, reduce wasting time, provide better experience and outcomes. So my quote, after 12 years in health literacy, education, research, and promotion, benefit of better health literacy for all. First, reduce illness. Second, avoid serious disorders. The third one, more effective healthcare service to the patient and communities. And the number 4 is more successful healthcare profession. How can we achieve better healthcare service? It's a continuous evolution, improvement. It's lifelong learning, and it's globally important lesson for future healthcare profession and the patient to serve better. How can we do it? Health literacy helps smart healthcare service. Now is the time to talk about the better, smarter healthcare service, because it's by the healthcare professions and health literacy to the patient and between patient and healthcare organizations. So health literacy is essential and critical to provide smart healthcare around the world. If patients with low health literacy, they have with a lot of problems. They're already suffering from illness, and they have to be even tortured by poor health literacy environment on organizations. So better health service and education need comprehensive health literacy intervention. Now in the world, we have a few university higher education ranking systems, the QS, the UI Green Metric, the THE, as well as some Spanish academic rankings. Most of these rankings still have some area for improvement. The current rankings of general university did not reflect the performance and professional achievement of health-related higher education. I have many good colleagues and students and staff. They're working in health-related university, medical college. They are not in a major university like the lowest ranking already pay attention to. So they have been omitted. They have been underestimated about their performance. And they are also meet the expectation of education for patient-centered health service, including technology, skills, humanity, and the resilience. The third one, the gap. Demand for high quality and quantity in healthcare service need concrete and practical evaluation tools. And this is something we need to develop. There's only one, the USA Newsweek, the world-best hospitals. But this hospital only identify a few top leading hospitals. This smart hospital ranking, it didn't reflect the service expectation by the community or by the countries, because it's only identify individual hospital, not the whole society. And there was a few years ago, higher ranking hospital by country per ranking type of hospital, but unfortunately such a ranking failed and didn't continue. So we are missing some of the better evaluation tool, accreditation tools, which can look at the patient outcome, how patient can avoid being falling down from their care or from healthcare organization, which has to be included in the future accreditation. I want to give you two examples of the current world ranking system about healthcare system. Is regarding whole healthcare service system. And there's a newer one. It shows the healthcare index by country early this year. And you see that Taiwan, South Korea, Japan, and Thailand are the four countries in Asia being pointed as very high. If we look at this, they are talking about healthcare index, like the overall quality of the healthcare system, including healthcare profession, equipment, staff, doctor, and cost. But it didn't touch upon the behavior, the service, the quantity, the quality of the service. And this assessment of the healthcare infrastructure service and so resources available in a special location, which has been well publicized, but I see there are still areas we can improve their assessment. The second one is the healthcare index by CEO World magazine. And they are showing some of the top countries in the world for healthcare. If you look at the index, comprehensive quality of a national healthcare system, including healthcare infrastructure, competence of healthcare profession, cost per capita in USD, availability of a quality medicine, and government readiness, seems to be comprehensive and in a higher level. But if you look at the result, Taiwan, South Korea, Australia, Israel, Japan, Singapore has been ranked high. But we need to go into more detail about how such ranking can be useful. If you look at how much money Taiwan, for example, pay for the GDP, Taiwan paid 6.6% of the GDP in 2020, which is compared much less than many of the OECD countries, which is around A. For example, Korea is 8.4, And you see the life expectancy with such a low investment, relatively low investment in GDP in Taiwan is going up. Means the expenses, financial, certainly is very important for healthcare quality, but not the most important. If you look at the person per year visit in a few countries, in Taiwan 12 times, which is lower than Japan 12.6 and Korea 16.6. But the higher doesn't mean the better. Certainly Taiwan enjoy very high accreditation in general healthcare service, but too much visit by the patient. And also the waiting time, if you compare Taiwan, Australia, Taiwan has only 10% of the waiting time in terms of cataract surgery, total knee replacement, and total hip replacement with Australia, and much better than many other, Canada, Netherlands, etc. So waiting time certainly is one concern to the patient. How patients are happy. In Taiwan, throughout the year, the National Healthcare Service has been enjoyed very high, even higher recently during the COVID. More than 90% they are very happy about this, and which is one of the indicators, the service outcome. But they are proven about how many clinic visits or dialysis or dental care per year, and also hospital admissions, which is not always the best for Taiwan or many other countries. So we need to look at the very detail about how this can be done. Another very important, respectable Joint Commission International, JCI, if you look at their recognized 870 organizations in 67 countries. Some of the countries like Thailand enjoy a very high number of the hospitals being accredited, but Taiwan and Vietnam and Japan doesn't. These countries do not recognized as a JCI important. Certainly JCI have some merit about being accreditation. I want to come back to the health literacy. If we look at how Japan, Indonesia, Myanmar, Kazakhstan, Vietnam, and Taiwan health literacy in general public, you see the difference in terms of health literacy can play to improve the healthcare quality and quantity, which is this is the publication we have done quite a few years ago, and many of you we are excited about this research. So we need to work on health literacy, how to use that to improve the healthcare quality, and how to use health literacy and also accreditation, the third-party accreditation to improve. I know that third-party accreditation like a JCI, they can certainly reduce the errors of patient, increasing the patient safety, increase benefit. That's a very, very well demonstrated, but there are also challenges. So my point is, how can we improve the involvement of health literacy in each part of this health education and service? And so it's a challenge for us for now and the future. The education development health literacy program in many of the higher education institutions need to be integrated and to be improved. The available assessment and intervention tool of the health literacy education in service, more recognizable approaches to improve health literacy for the public, and more recipient patient-centered approaches. For example, health literacy program for children and school children, which is very important. Now, it's about time for health literacy-oriented higher education accreditation and ranking. And one of the top priority I mentioned in past 2 years is the health literacy in education and training for students and staff for university, healthcare related to university, medical school, dental school, pharmacy school, nursing school, as well as the hospitals, which is the way healthcare profession can grow our capacity to provide better health literacy empowerment and also improve the healthcare quality. And so that is my key take-home message, that I wish this would be useful for you. And finally, I hope all our effort with ACRA, with Apply HE, work together to come up with new ranking system for higher education in School of Medicine, School of Healthcare Sciences, can come to a good result in early May next year. And at this time, I wish you all a very lovely Thanksgiving days, but also Happy New Year, Merry Christmas, and wish you all the best. Thank you.
Thank you so much, sir, for your enlightening talk, sir. It's my privilege to introduce our second speaker for today's webinar, Miss Mandy Mok. She is a prominent individual with an impressive track record in the field of higher education. Her journey began at Quadrical Simons in 2002, where she played a pivotal role in driving international higher education initiatives, particularly in Asia, the Middle East, and Africa. As the CEO of QS Asia, Mandy provides universities in the region with top-notch branding consultancy and student recruitment services, contributing significantly to the higher education landscape. Founding Applied HE recognized the unique needs of institutional not captured by traditional ranking measures. When he found Applied HE in 2020, his agency's focus on employability, quality of teaching and learning, and collaboration with industries, reshaping the way we assess higher education. Applied HE is the forefront of the technology-driven higher education branding, rankings, ratings, and professional networking. Mandy combines her vast experience with big data and artificial intelligence to revolutionize the industry. Beyond her role of applied HE, Mandy serves as the ambassador of global engagement as Ansurian University, where she leads international outreach efforts and initiatives for global engagement. Mandy Mok's dedication to higher education and her innovative approach to addressing its evolving needs make her a valuable speaker for today's webinar. Over to you, ma'am.
Thank you. Good afternoon, everyone. My name is Mandy Mok, and I'm the founder and CEO of Applied HE. Applied HE is an international higher education service provider, and we specialize in strategies and solutions for evaluation, global branding, and marketing for the higher education sector. After almost 20 years with QS, I've decided to start Applied HE. So we are the latest addition in the higher education industry for rankings, ratings, and strategies for global branding. As you're all aware, the higher education industry is constantly evolving, and it is crucial for universities to remain competitive and relevant. And this is where we can help. We provide innovative solutions and strategies to help universities to succeed in today's competitive landscape. Today, I'm going to discuss the transformative power of rankings in the realm of health literacy and education, particularly in the higher education sector. In this ever-evolving landscape of higher education, especially in the fields of medicine and health sciences, the role of rankings have grown to be more influential than ever before. And rankings, often seen as a measure of academic excellence and reputation, have a far-reaching impact that extends beyond mere numbers and positions. Now, Peter has mentioned about the current gaps in the industry for rankings of schools of medicine and health sciences, and that's why we want to introduce a new ranking for School of Medicine and Health Sciences. I will touch upon 8 key reasons why rankings are important, and of course there are many more reasons out there, but these will give us a good start to understand why a ranking system for schools of health, for medicine and health sciences is a good idea. Now, rankings can help students choose the right school. They're like a guide to finding the best place to learn and grow into future healthcare leaders. When a school ranks high, it attracts the best students and teachers. This is super important for teaching and learning about health in new and better ways. Rankings make schools want to do better. They push universities to keep improving their courses, their research, and how they can teach better, etc. They keep education up to date. With rankings, schools have to stay on top of the latest in medicine and technology, which is great for students. Rankings can change how schools plan their future. They encourage schools to use their resources wisely, which is good for everyone, including the students, the teachers, and the healthcare world. Top-ranked schools get to work with famous organizations worldwide. This means students get to learn from different perspectives and new ideas. And rankings remind schools to focus on more than just grades. They encourage schools to care about their community and support their students in many ways. And lastly, rankings aren't just about being the best. They help schools grow and improve healthcare education and services, making a difference in health literacy around the world. So you see, rankings in medicine and health sciences are more than just numbers. They push for better education, innovation, and health understanding. And with that in mind, let's move on to our next exciting topic, the launch of the Applied HE AHLA ranking for schools of medicine and health sciences and the teaching hospitals. So I'm very excited to share this new initiative with you. It's in partnership with AHLA and it's an international effort that's focused on ranking health sciences education and healthcare quality. We're introducing a first of its kind ranking in higher education, targeting medicine and health sciences schools and the teaching hospitals. This unique ranking includes, by including teaching hospitals, we are making a significant step up in employability. It's potentially a game-changing move by AHLA and Applied HE. And our goal is to recognize top medical schools and the teaching hospitals for their roles in health education, medical excellence, and patient-friendly services. We hope you'll be part of this groundbreaking initiative because your involvement will raise the bar for health literacy and medical education worldwide. Why did we partner with AHLA? Applied HE is the first ranking and rating organization in Asia. The ones currently available are generally from the West. And AHLA is also the first association to promote health literacy in Asia, and they aim to provide an upgrade of health literacy levels across Asia and beyond. So there is a great synergy between Applied HE and AHLA. This is a good partnership, and together we want to provide an overview and measure health literacy status, as well as to develop suitable tools to measure and promote health literacy and health education across Asia and beyond. A point to consider is that there are subject rankings by other ranking agencies, but there are no rankings that includes teaching hospitals. So this proposed new ranking is both unique and innovative. So why a ranking for health education and hospitals? Because a ranking, as mentioned earlier, can guide students in choosing the right school, and it is especially beneficial for lesser known institutions and students from outside the region. Rankings also encourage institutions to benchmark themselves, identifying areas for improvement and promoting best practices. And the general public always perceive that medical and health sciences education are often about research excellence. This is not the case here. We want to highlight the voice of students, faculty, alumni, and patients for a more all-round perspective. For evaluation tools for School of Medicine and Health Sciences, we look at those that offer recognized degrees in medicine, dentistry, nursing, pharmacy, public health, rehab medicine, psychology, and all other allied health sciences. And for the teaching hospitals, we evaluate medical facilities and teaching hospitals that are involved in clinical training of health sciences students. For medicine and health sciences schools to qualify, you need to offer all the recognized degrees that I just mentioned in my previous slide, as well as all the other allied health sciences. Schools must also have a minimum of 200 students currently enrolled and a minimum of 200 graduates and alumni. For teaching hospitals to qualify, they must be owned, managed, or affiliated with a school of medicine or health sciences, and they must also have a minimum of 80 beds and at least 200 outpatient treatments daily, plus a minimum of 200 trainees on site annually and for all disciplines. There's also a small admin charge of 5,000 USD to participate in this ranking. This is to help us defray admin and logistics expenses. And the fee is for one university with a maximum of 3 colleges of medicine and health sciences and the teaching hospital. These are the ranking criteria for School of Medicine and Health Sciences. We look at teaching and learning, 30%, diversity and inclusion, that's 30% too, clinical practice, 30%, peer reputation and research, 10%. This is for the criteria for the schools. And these are the criteria for the teaching hospitals. Basically, They're the same as the medicine and health sciences schools, but to a different audience. For schools, we look at students and faculty, and for teaching hospitals, we look at trainees and teaching staff. The weightage is the same: teaching and learning 30%, diversity and inclusion 30%, clinical practice 30%, and peer reputation and research 10%. I won't go into this, I think I covered that. So for the timeline, we need a minimum of 10 schools to register by 15th of December to kickstart this ranking. So we do ask for your support. This ranking was only launched a week ago on the 17th of November. So it's still very new. The official ranking results we aim to announce at the 10th ALA conference on the 13th of May 2024 in Ho Chi Minh City. That's next year. We believe that this initiative will not only enrich the content of the AFLA conference and future conferences, it will also put the spotlight on health literacy, your university, and the teaching hospital on the global stage. As mentioned, we had a soft launch recently, and the response was pretty good. Here are some endorsements from our AFLA members and friends. And I'd like to take this opportunity to inform everyone of a momentous event that's happening in Cebu City next Friday. We're thrilled to announce the upcoming launch of the Applied HE Public and Private University Rankings for the ASEAN region. This ranking is different from the others. Not only are our methodologies different, but also the way we present it. We are separating the private and public universities so as to compare apples to apples. This is especially in answer to many private universities because the current rankings available is quite an unfair presentation of private universities. This event is held jointly with the Annual General Assembly of PAHUCOA. They are the official accreditation body of the Philippines. So I'd like to extend a warm welcome to all if you can make it. I know it's quite tight, it's next week. Registration is still open. Please visit appliedhe.com for more information. Hope to see all of you in beautiful Cebu next week. As I conclude my presentation, I want to emphasize our identity and purpose. We are a team driven by creativity and innovation, dedicated to crafting fresh and ingenious strategies tailored specifically for you. As the well-prepared new kid on the block, we are enthusiastic about helping your institution to thrive and excel. Thank you very much for your time and consideration. Thank you.
Thank you, ma'am, for sharing your valuable insights on the topic. Now I would like to invite Dr. Tien Wang Dong, who is working as Assistant Professor in School of Nutrition and Health Sciences, Taipei Medical University, Taiwan. Will be the moderator of today's panel discussion. Over to you, sir.
Thank you very much for inviting me as the coordinator or the moderator, whatever there, just discussion panel. Thank you very much, Professor Peter Chang, and also Mandy Mok for giving the outstanding presentation. You two are the leader of two organizations, ACLA and also Apply ACs. And we just very happy to hear the progress of these corporations. And Professor Peter Chang mentioned about the role of the health literacy and also the smart health services, and how we're going to put health literacy into the rankings of the university and also our teaching hospital. Mandy Mok just mentioned about methodologically and some clarification how teaching hospital and also the medical school or health related school can join this effort. Now I'm open for the question and comments from the audience, if you have any questions. Okay, we have one question from Professor Dan Navim Zamir from Israel, who asks, who conduct the accreditation? So,
do you mean who conduct the rankings, not accreditation?
Yes, could be.
We are the ones doing it. Applied HE is the agency that's doing the rankings.
Yeah. So to clarify, Apply IC doing the rankings for public and private universities with the different sections or different kind of ranking. And for Apply AC and also Apply Effort, we have AA ranking, so-called in abbreviation we just discussed earlier. So AA ranking is to consider health literacy in the rankings. Any further questions? Whether the participant can speak out or they just only type? Spotting or Abina? Can the participants speak out or they need to type? Usha, yeah, you have a question?
Yes, hi. Yeah, it was an excellent presentation. So I have a doubt, like, ranking has been given. So there is a weightage for every criteria. So what is the weightage given to health literacy, and under which category the weightage has been given?
Could you refer to questions?
Yes. The health literacy is inclusive in all the weightage there.
Yeah, what proportion has been, how much proportion the weight is given to health literacy, and under which domain?
Under the School of Medicine and Health criteria for the School of Medicine and Health Sciences, under diversity and inclusion, 30%.
Thank you. So is there a mechanism to capture, like, what are your KPIs? What are your key performance indicator that you capture, specific indicators?
It's largely by surveys. So that's the main mode of the rankings.
Thank you.
Maybe I supplement a little bit because we have been a long discussion with accreditation body, the ranking body, the PSPH, and I thought that health literacy should be many ways, including how the schools, the university faculty teaching the student. I mean, are they teaching the substance with health literacy in mind, that the student can practice better health literacy oriented service. The second is that the institution health literacy, organization health literacy in the hospital, in the university, which has been having quite a lot of development in the past few years. And I recommend PSPH to take these examples into their ranking. So institution apply for the ranking, they will receive a questionnaire in details. And also teaching hospital certainly is very important because we want health literacy to be practiced in daily practice, the service provided by the healthcare profession in hospital. So we ask how patients understand, which one of the very key important, do they understand how healthcare profession help or instruction to help to understand the health practice. So I'm putting a lot of material to the PSPH. I hope they put this key element into the ranking.
Okay, so thank you for the response. We have another question. How do the university ranking affect the recruitment and retention of the faculties with expertise in health education and literacy?
How do rankings affect? Well, rankings
talk about
generally...
recruitment.
Sorry, again?
Yeah, we talk about the effect on the recruitment and retentions.
Well, rankings generally attract talent whether it's good students or faculty. So rankings is a form of measurement, if you want to call it that way, for your school. So you, with rankings, you'll be able to attract top talent.
That's certified. Yeah. Any other questions? Actually, to clarify that this ranking, I think, is error happened in the past that YSC consider the student and also consider patient in the ranking. Other ranking consider professions.
That's right.
And you know, if you rank in the hospital, you only ranks their performance, doctor performance, nurses performance, and system performance. And this ranking they consider also the patient as university, and they consider the student and also alumni. So that is something new, and we consider more, not just only provider but also the user. So of course, when we have better ranking, which means that in their inside policies already have some attraction, right? Some incentive to retain the faculties and also to recruit the new talent faculties and also the staffs. Yeah, Krishna, you have.
Yeah, hi. I have another query to both the speakers of today's session. How do you see including health literacy in higher education ranking system is going to change the conditions of the population, the health conditions of the population, how it will impact on the general population? How do you see that?
Well, I think health literacy, like I present in the uh, uh, first part of the presentation, is that health literacy help patients taking proactive action regarding prevention, and they are in a better situation to understand the healthcare service provided to them. These are the two very critical health literacy. But on the other hand, health literacy uh, can also help the healthcare profession, because we are now bombarded with a lot of new information and misinformation, and the healthcare provider was distracted a lot by all this kind of information, and we need to handle this much better way. The fourth way is that reduce the waste and ineffectiveness. It's very critical, because now we are demanding much better healthcare service in quality and quantity. And without good health literacy in the patient side, but also in the healthcare provider side, we cannot reach that. And around the world, we know we just passed through the pandemic. We know how much we have to learn before the next pandemic come to us. The whole system of healthcare service and education has to be revolutionized. It's not ready yet. So I think we have to learn from the failure. Health literacy is one of the way that we keep patient in a much better way, working with us as healthcare provider, as a team, not as just a recipient. So I see this, and that's the reason I'm very much interested in putting this into a rank, because we need to influence the healthcare provider and also the teaching faculties, universities, how to use the best way interest of the health students in the work they are doing. I hope we can achieve and push this in a progressive way.
Yeah, thank you very much for the response. Yeah, this is very, very important rankings, and now we call for the participants from different university and teaching hospital across Asia first, and later we expand it to the world. There's one point in the presentation from Ms. Mandy Mok that if you have the regional universities, right? Let's say you have a university and she just charged only once, but in sub-university, maximum can have 3. And if your university have the hospital, and it includes 2 faculty or 2 college or 2 universities, sub-university and 1 hospital for free, and that'll be very good price for ranking and to do the global branding. Anyone have a question? You can raise your hand or you can type in the chat box. While you're waiting for someone typing the questions, I just have some more discussion over here that Professor Peter mentioned about the third-party ranking, which is less bias, less errors, and also increase the benefit over here. And now Apply SA is one of the third party. We say the third party to rank for the medical school and also the hospitals. However, there's some argument that there's some local judgment, and how are we going to add in, because the healthcare system in different countries may varies in terms of the practice and also the culture, and whether these can be considered into our ranking, and how we're going to adopt that. Could you respond to that concern?
Maybe Mandy, you can respond to that. Cross culture and
yeah, usually one shoes cannot fit on the feet.
Yeah,
So,
sorry, I missed that question. Somebody muted me. What's the question?
Yeah, okay. The question is, now we consider the third parties ranking is less bias, more benefit.
That's right.
And Apply AC is one of those. The question is, there's many local institutions or different hospital, university, they consider about the local adjustment. They have their own culture, they have different practice, and would you consider the culture and also some local practice or their policy into the ranking? Because one shoes cannot fit on feet.
Yes, of course. By having a third party, of course, is unbiased, and because we are also a ranking agency, we have the means to market and promote all these worldwide instead of in just one region or one country. So that's the advantage there. And as for dealing with the culture of different countries, please bear in mind this is just a first pilot. We welcome any feedback, and as much as we can, we would incorporate into the rankings to, make it a more all-rounded ranking for everybody in Asia for now.
Any supplements or any additions from Professor Peter?
Peter, you're muted.
Oh, I'm sorry, I didn't catch the question.
Yeah.
Question.
So will you consider the local adjustments and also culture practice into the ranking? And if you have any modification or only one standard to rank every school or hospitals, so we will become one. We will become one system only.
I'm surprised that you didn't ask about language. Actually, the questionnaire will be in different languages. They have to be in different language, because for student and for patient particularly, they should be in different questions. So the hospital participate in this. They will develop their own question in their own language. Now, certainly healthcare system in public hospital private hospital, public university, private, they are all different. But I think at this stage, we would not consider financial structure, legal structure, because it's a college of medicine and health sciences. I think all the country have similar education system and healthcare system. We have very universal and international recognized ethical things. I'm very happy Diane is on with us as a close friend and as an advisor in hospital around the world and the patient around the world. There's no difference. We say that human right, health right is disregard what kind of language and politics or religions or what's their financial background. We have been working on that. So at this moment, I don't feel like financial or regulations thing would be too much different. I mean, the hospital taking care of patient is universal around the world. It's not something we say, okay, they cannot do it.
Yeah, thank you very
Yeah.
much. And I believe that we can build a very good accreditation criteria, a ranking criteria that is less bias or no bias in ranking different hospital and university across Asia. And I expect that if we have any price, a different price for ACLA member, maybe it will be better in the future. If non-ACLA member, you will be charged more, but if you are an ACLA member, you may have some discount, and hope that will be considered in the ranking. Okay, there's one question left here, that is the patient awareness and education also can help in ranking the higher education.
Are you asking us to add in these two criteria into the rankings, Shivanan? If yes, yeah, I think we can consider that.
Yeah, it could be one of the criteria to assess the patient, right, or a student in the school. Certainly we can consider that into our ranking, and maybe we already have. Okay, any further question, Dr. Usha? Oh, wait, you raised your hand.
Various countries and various population demography has a different level of education. If education, patient's education becomes one criteria, then many good hospitals might not fit into, because population which belongs to a rural area where education is at only a primary level or a very low level of education is there. But yes, they are health literate in terms of they are able to take their decisions and they are able to understand about their health. So they might be called as health literate, but they may not be educated. So then this discrimination is very thin line, and when such criterias are included, we need to be very cautious
Yes.
about considering the general education or which type of education are we looking at from the patient's perspective.
Noted.
I think the comment is very critical. Actually, I was discussing with the design approaches that the most important is that the hospital will ask the patient. There's a minimum number of patients they have to ask them to respond neutrally. Say that, do you understand the doctor's prescription? Do you understand the nurse's suggestion? Which is a key element of the health literacy. I mean, disregard what kind of education label, or maybe they don't understand the writing of all these medicament. But the key is that does the hospital provide adequate communication and service to the patient they serve? And that's the reason we want to ask the patient: do they understand? Did they have? Do they understand how to protect themselves in a better way? I think this would be very simple question. We are not asking question to the patient about what advanced level biology they take or not. We will not ask. I hope. I hope.
There's a question here from Diane. Can you expand more? What do you mean by teach back?
Yes, thank you. Good morning, everybody. It's Diane from Tel Aviv. This is such a wonderful discussion, and thank you for allowing me to participate. Just building out what Professor Chang mentioned, I would even recommend taking one step further, because we know people in many cultures, if you ask them if they understand, they will say yes out of respect. But if we really want to know, did they receive enough input to be able to know what to do when they go home, there's the teach back method, which has been used very widely in health literacy and patient education. And all the provider, whether it's a doctor, nurse, or any other health professional, has to do is say, I want to make sure that I've been cleared. Can you explain what you will be taking from our discussion, what you will be taking home with you? Or what will you be telling your spouse? But it's, again, the onus is on me as the provider. I want to check that I've been clear. So I don't want to say, did you understand? Because that kind of makes people feel they've been tested. So all you have to do is use what's called the teach back method. There's a tremendous amount of literature about the effectiveness. And just say, I want to make sure that I've been clear. Can you explain to me what you've taken from our discussion, or what will you do when you go home? That's all. So even just asking the question can be a criteria for health literacy. It's very easy. Thank you.
Thank you.
It could be the open-end questions.
Oh, sorry, yeah.
Okay, so I think the time is up. It's already 1 hour. So thank you very much for the wonderful discussion, and also especially to outstanding speakers today. And you bring to us a new idea and new way to rank the university and hospitals. And if you have any further questions, please contact them directly, or you can send to the local organizers of this event, and we may have further discussion by email or maybe another workshop. So thank you very much, everyone. And I now return microphone to the host. Thank you.
Thank you, sir. The panel discussion has concluded, which brings us to the end of this session. It has been such an honor to be a part of such a wonderful event. On behalf of MHLU and AHLA, I would like to extend my heartfelt gratitude to our esteemed speakers, moderator, faculty, staff, and student of MAHE, member of MHLU executive boards, and member of AHLA. In the end, I extend our heartfelt thanks to Professor Dr. Helmut Brand, Founding Director of Prasanna School of Public Health, MAHE Manipal, Administration of Manipal Press and Media, and all the support we have received. I have not mentioned the names, but many thanks to each one of you who has contributed directly and indirectly in conducting this webinar. Thank you all.